When we attended Neapacoh 16, Neapacoh in Tanzania, we had an opportunity to meet various parliamentarians from the various countries. And out of that engagement, NEMA has had an opportunity to do the benchmarking arrangement with Ethiopia, with Malawi, with Uganda, with Botswana, and most recently Nigeria was here. All that happened because of the engagement we have had by being part of the Neapacoh meetings. Thank you.
Okay, and I know you've mentioned that you hope to gain a lot of knowledge and strength from this forum. What plans do you have in terms of just leveraging from the forum's discussions?
Thank you. So as we attend the meeting on Wednesday with Neapacoh, we as NEMA will be sharing our story to the region. Firstly, we would want to understand or would like to share with the rest of the region how NEMA started, what was the design, what worked, what didn't work, and how resilient NEMA has been from the time that we started. We've had a lot of challenges, but what is good is that we know what has gone wrong and we know what we need to do, and we know what policymakers in the name of Neapacoh are supposed to help us for us to prepare NEMA to the mandate that has been given.
Okay, Dr. Lishimpi, I get to you. What specific benefits do you envision for Zambia's health sector, especially that Zambia is now hosting the Neapacoh Forum? What benefits do we expect Zambia to get?
Thank you very much. This is a very important conference, and as you know, Zambia has been implementing strategies to achieve universal health coverage, and our primary vehicle for delivering this is strengthening of our primary health care service and establishing a very strong community health care response. Because of that, we anticipate several tangible benefits during this conference, and we expect that out of this collaboration with other African countries, we will learn new practices maybe from other countries, how they are mobilizing domestic financing to implement in the provision of primary health care services. Like I already said, in Zambia we have agreed that we should increase funding to primary health care by 16% in order for us to achieve universal health coverage. And also there is a big effort there in terms of disease control. How do we prepare our country to be able to respond to shocks from climate change and other emerging diseases, as well as outbreaks like cholera, mpox, you know, those ones. So all these issues are going to be discussed, and we are hoping that we can explore areas of new funding opportunities, technical expertise, and innovative technologies. Remember that for us to be in this environment, for us to achieve universal health coverage, we need a lot of information, we need a lot of data, and therefore digital health tools become absolutely important for us to be able to see what is going on within the country and be able to collect this information and use it for planning, for disaster preparedness, all these other issues that are important to ensure that we support the health sector. National Health Insurance Scheme, very, very important. Like she has already mentioned, it is one of our arms in here in Zambia of achieving universal health coverage. So we want to learn how are the other countries doing it, what can we contribute to the other countries, what can we tell them that this is what Zambia is doing, and especially when you look at how do we support the very extremely vulnerable populations here in Zambia using the national health insurance, how do we get to them? So all these areas we want to see how we can learn and envisage benefits from it.
Okay, Mrs. Calloway, from what Dr. Lishimpi has just said and brought out, how is the Neapacoh Forum important for the National Health Insurance Scheme? I know you did mention earlier you even actually attended the 16th Neapacoh Forum. So how is this forum important?
Thank you, Tessa. Again, this forum is very critical because we would want to understand, firstly, how are they managing their benefit package? What is it that they are offering? Secondly, we want to understand how are they engaging the public. As you may know, over the a bit of outcry here and there regarding one or two things, but would want to learn from the other countries. How are they engaging the public in line with national health insurance? Thirdly, would want to understand how are they doing the registration expansion to the remotest people, the informal sector. How are they engaging to be able to get all the masses out there? What about their contributory rates? We want to benchmark. How are they doing it, so that we can know where to get some manipulation or adjustment in Zambia in line with what the region is doing to get that is working well. What about in terms of paying their claims? How are they doing it? What are the billing modalities that they are using? Because like I said, Neapacoh is bringing together parliamentarians, but it's also bringing health financing experts. It's also bringing civil society. It's also bringing academicians. So during this meeting, we want to have sideline meetings, network, and see how are they managing the claims. How about the actuarial analysis? How are they doing it? So that we see how to engineer that what you are already doing. We want to learn from the region. So this forum is very, very critical for us, and we want to use every opportunity to see what we can tap from the experts that are coming for this forum.
And how would you describe the working relationship with the Parliamentary Committee on Health?
Thank you. Working relationship with our local parliamentary committee has been excellent. As you may want to know, within that committee, others are doctors, others are ICT specialists. So we've learned a lot. They've been to our offices to understand NEMA. They understand NEMA as if they work within NEMA. They have taken time to go to the remote areas, to the regions, the provinces, together with NEMA to understand what we are offering to the populations out there. We've been here at Parliament to be able to tell a story on how we are managing NEMA, what challenges we are facing, and as we speak, all the committee members understand what NEMA is about, what challenges, how did we start NEMA, what model did we use, what has gone wrong down the line, and they have been our mouthpiece. They have actually written various papers to Parliament to be able to lobby on our behalf on whatever policies we need to change, on whatever legal reforms we need to change to make NEMA operation better than what it's doing right now. So we've worked very, very well with the parliamentarians locally.
Thank you very much. And to our viewers, we would like to say thank you very much for tuning in to Parliament Television, and of course our listeners that are following us on Parliament Radio, and our viewers that are following us on our social media platforms. We appreciate your viewership. This is the 17th Network Forum update, which we've been bringing you ahead of the forum, which Zambia will be hosting from the 25th of February to the 27th of February 2026. Dr. Lishimpi, I throw the same question that I threw to Mrs. Calloway. How has your working relationship been with the Parliamentary Committee on Health?
Thank you very much. Rightly, like you said, the Parliamentary Health Committee is an oversight committee that looks at how we are implementing health services as they have appropriated in Parliament, because Parliament is the one that approves our budget allocations from Ministry of Finance. And following that approval, they are very interested in making sure that we are implementing the budgets as they have approved them. So that is on one side, making sure that the monies are released to the Ministry of Health, and the Ministry of Health is implementing these budgets as agreed in the Yellow Book. And because of that, there are certain key functions they have played together with us as Ministry of Health to check on projects that we are implementing in that fiscal year, and to ensure that those projects are being implemented as agreed, and also to look at the policies surrounding the Ministry of Health. Recently you heard that we have actually produced our new national health policy, and which was approved by Cabinet, and that has consequences in terms of now looking at the Health Services Act, which is being reviewed now. There is a new health services bill that is undergoing review, so that would be now the act that will be approved to handle the legal aspects of the Ministry of Health going forward, and also to look at the strategic plans of the Ministry of Health. How does this Ministry of Health how should the Ministry of Health look like in the future? are we going to design a structure of the Ministry of Health that is going to answer the questions that are coming in the near future? So this is the committee that we interact with. The chairperson of the health committee and myself, we are always in discussion so that we are looking at specific areas and making sure that we are succeeding from all fronts. So we as Ministry of Health are very, very grateful that this committee exists, because sometimes when you speak from the Ministry of Health, we may not get an increase in our budgetary allocation. Like you've seen, there was a reduced overseas development assistance. And if you look in the 2026 budget, there's been a 30% increase in terms of medicines from 2025 to 2026. So in 2025, there was 4.9 billion appropriated. In 2026, there's 6.2 billion appropriated to medicines alone. So this is a 30% increase, and these are some of the areas where you can say that this was as a result of collaboration between Ministry of Health, Health Committee, and the Ministry of Finance.
Okay, and I'd just like to make mention that actually this year the Planning and Budgeting Committee will be attending this forum. I know you've mentioned budgetary allocations. How does this make you feel, coming from the Ministry of Health, to know that the Planning and Budgeting Committee, which is also involved in the budget itself, I know that Committee on Health is involved, but now we do have the Planning and Budgeting Committee, which will also participate. How does that make you feel?
I can tell you it is one of those things where the current government has agreed that we must implement things using the one government approach. Ministry of Finance and the Budget Committee cannot do things separately from the Health Committee, from the Ministry of Health. So all of us need to come together at one point so that we are speaking the same language. We understand what are the needs of the Ministry of Health, how much money should we appropriate to them, and why. So if we are able to justify using the Health Committee to the Budget Committee, that is very fantastic.
Okay, and moving on, Mrs. Calloway, how does National Health Insurance support universal health coverage in Zambia?
Thank you so much, Thais. Again, like I said earlier, NEMAS was formed in order to supplement the government efforts towards enhancing financing of the Ministry of Health. So to that effect, for us to achieve the universal health coverage, which NEMA should be able, and which it has been doing from 2020, be able to supplement the Ministry of Health in terms of expanding their availability of infrastructure and general funds for them to be able to, for the members to know that if I go to this facility, I'll be able to find a building, I'll be able to find the medicines, I'll be able to find the doctors that are working. Secondly, NEMA's mandate also is to ensure that people should not shun from going to the healthcare facilities, knowing that when I go to the facility, NEMA will pay, and that reduces the out-of-pocket expenditure. So if they are reassured that when I go and get the service, there's somebody who will pay, the way of seeking health service will be increased by the general populace. Thirdly, the equity of access. As you know that NEMA, currently we pay 2% of your basic, you and me, but there are also people who are paying 1% the informal sector. So we believe in equity. Despite the differences in the amount that we contribute, we ensure that when you go to UTH, when you go to Care of Health, you get the equal service. So that encourages our population to be able to seek health service. Fourthly, NEMA is promoting private partnership. The private healthcare facilities, we've accredited quite a number of them, over 200 of them. Why have we done that? So that we back up Ministry of Health. Where they're not available, we ensure that there's a private facility. And also by so doing, we are expanding the availability of medical services in the countryside. Also, deliberately, NEMA has embarked on making sure that all the mini hospitals that are found in Shangombo, that are found in Monze, that are found in Kaputa are also accredited, so that our people, our members, our teachers who are out there in the rural setup are also able to access, and through NEMA, these mini hospitals are able to tap money so they have basic requirements that they need to be able to meet our members. So through these strides, that way NEMA is driving towards achievement of the universal health coverage, where all people are registered, where all people are able to meet medical services wherever they are and whenever they need it.
Okay, I get back to you, Dr. Lishimpi. I just would like to know, and I'm sure the viewers and listeners out there would like to know, what's the importance of this 17th Neapacoh Forum to the Ministry of Health?
Okay. First of all, we have already said that we'll be learning from the others. This is African parliamentarians coming together to support health services. So as a Ministry of Health Zambia and as a hosting country, we expect to showcase some of our achievements that we have had in universal health coverage, for instance. And these include our National Health Strategic Plan with a focus of strengthening primary health care services using a community health approach. Yeah, and we have seen some of these things like the increase in the number, first of all, the conversion of monovalent community-based volunteers to trained polyvalent community-based volunteers who are now beginning to get incentivized. Then there's a second tier of community health worker that we've created that are on the civil service payroll, public service payroll, called community health workers. Those are getting a 1-year training in designated places in the Ministry of Health, and after that they are then recruited to assist in the decentralized delivery of health services at a health center level and health post level, so that they can be interfacing with the community and supervising these other ones that are in the communities. So there is a lot of shifting that is happening, but this is the pieces we need to learn. If you overlay digital platforms over just this community health piece, some countries like Ethiopia, Kenya, and I think Uganda have done pretty well and have advanced. So we would want to learn, how has Kenya managed? Some of the things that Kenya has done is to make available extra equipment to these community health workers. They've got a community health worker bag which has a tablet in it, and it is GPS enabled. It has a AI enabled platform, so that when the community health worker is interviewing someone, that platform sends remotely to the health centers, so that they are able to see what kind of symptoms are these community health workers collecting, and they are being collected in certain sensible areas, so that you alert the district quite early if you begin to see, this could suggest maybe cholera case, or this could suggest maybe a meningitis case. So you'll be able to respond quicker than later. So these are kind of the things, and also it helps us to understand how other countries have implemented this at a little bit higher level, say at district hospital. What have they done to change what was there, which we are doing in terms of providing of more digital x-rays, more laboratory machines, more ultrasounds and everything. All this is being done to support, 1, reduction of maternal mortality, to support 2, reduction of childhood mortality, and ensure that we are improving nutrition in the community so that we reduce stunting. Now, these are big areas that if you succeed, the whole health sector and the whole of government improves in terms of the way you deliver services to the people. We've got this health in all policy that we are also following. So Ministry of Agriculture, Livestock and Fisheries, everyone, mines and Home Affairs, Defense, they must have components of health as they deliver their services. So this is important, so that we all are acting together to make sure that we achieve what we say we should achieve out of the SDG goals that are set for each country.
Okay, and just now we do take a short break. This is the 17th Neapacoh Forum update with me, Tazapiri, and my guest, Dr. Lishimpi, Permanent Secretary, Technical Services from the Ministry of Health, and I do have Mrs. Calloway, who is Director Health Insurance Services from NEMA. Keep watching Parliament Television.
Get ready for the 17th meeting of the Network of African Parliamentary Committees of Health, Neapacoh, from 25th to 27th